So we had over 30 who have already responded and given us all their information about what services they're offering, their hours, and all that kind of stuff. So that was pretty cool. We were surprised about that based on last year's outcomes for the same type of project.
Great. John?
Yeah, I'm excited. The 12th and 13th of next month is our first, or my first convention with Shami. So I'm very excited about that, and we're gearing up for it and looking forward to it. So I guess that would be my awesome for the day.
Great. Betsy?
Well, let's see. That was good timing because it follows right on what John just said. Is we're planning our conference, which for the first time will be annual. We've often done every other year or every third year, but we had one last year in April, and we're having another one this year. And we went and looked at a great place today that is just really awesome. So we are hoping that the board all is interested in going along with it, and we'll be holding our conference there. It looks like it will be in April of 2016.
Great. Kelly, are you on the line? I see you're on the internet, but I'm not sure if you're logged in on the phone.
I am. Can you hear me?
Oh, hi, Kelly. Yep, we can hear you.
Hey, wonderful. Okay, well, we are just celebrating the opening of a new school-based health center this week, so you'll be getting an email out. It will be our 121st, and we are anticipating that 6 more will be opening by the end of October.
That's great, Kelly.
Yeah, considering we got a funding cut from our state line item this year, and we're still opening them, it's really heartening.
And next we have Julie. Welcome, Julie, to the first policy call for you.
Yes, it is. Yeah, I was going to say this is my first policy call, which is awesome in and of itself. So thank you for having me. But I guess the other thing that's awesome that we're working on right now is we got a state grant from the Department of Health to expand our first, what was our first school-based health center to serve the broader community. It's in a promise zone and just a high-need, medically underserved area and a really great host school. So we're working on that expansion right now. So that's pretty awesome.
Great. And everyone on the call, this is Julie from Pennsylvania. She is representing Pennsylvania today.
Yep.
And then is Kevin, are you on the call?
Yeah, can you hear me? I think I'm muted.
No, we hear you.
Oh, okay. Sorry, I wasn't sure. Yep, I'll just second what John said. Here in Michigan, we're doing the annual conference in a few weeks, so that's pretty much where all our focus is.
How many people are you expecting?
Well, I think combined, we're partnering with the state of Michigan, so I think a total of close to 200 people will be coming out for it.
Great. Is there anyone else on the call who I haven't called on? Nope. Great. So now I'll hand it over to Suzanne, who will give you a Capitol Hill update.
Hi, everyone. This is Suzanne. So I have a few updates regarding some federal legislation that we're monitoring. Some of them are sort of non-updates, but I know we have some newer folks on the call, so I just want to share them to make sure everyone's aware of our federal priorities. So the first one is the Comprehensive School-Based Health Center Bill, which hopefully everyone is familiar with at this point. But this is something that we've been working on really since May, June, with Senator Stabenow's office. Her office has wanted to do a comprehensive school-based health center bill that will include a number of things: Medicaid payment fixes, a grant program to run federal clinical operations, a federal grant program for that, and a number of other pieces. And the original timing that her office was hoping for was a September bill introduction. The time with back to school, that obviously has passed because we're now heading into October. We are in regular communication with her office, and part of our challenge is that we're still trying to figure out how to build out certain sections of the bill, in particular the Medicaid piece. So we're continuing to work with her office, and I'm hoping that maybe by next week we'll have an updated timeline. We're talking with them again this week. So that's kind of where that stands. So hopefully soon we will have a bill, and we will definitely be engaging the field on that. Second, ESCA reauthorization, the Elementary and Secondary Education Act. There's really no update to report at this time. I don't think anything much has really happened for the past couple of months, at least that is public, that we know about. As you may remember, a few months ago in July, the Senate passed their version of a reauthorization bill, which was very bipartisan. It had a lot of really strong health and wellness components, and we were actually successful in getting in some language in the bill that would have made some of those health and wellness services, that would have made providers and school-based health centers possible eligible entities for providing some of those services. So as it stands now is that the House has their bill that they passed in February, which is very conservative, does not include a lot of the strong health and wellness pieces in the Senate. So we know that both sides are sort of in an informal conference or negotiation process right now on the two bills. So hopefully soon we'll see an update on that. We expect that those differences will be worked out, and that we will have a bipartisan version of the bill. We know that this is a priority for the administration, and they really want to get something done and get a compromise. So hopefully soon we'll hear more about that. So thirdly, mental health. So there are a number of comprehensive bills actually in the Senate, in both the Senate and the House. A couple months ago, Senator Murphy from Connecticut, along with Senator Cassidy of Louisiana, they introduced a comprehensive mental health bill in the Senate that was it was sort of primarily focused on adults, but there were some pieces in it for children and adolescents. And we think that they're a good start, but that they need to be strengthened. So we've been in conversation with those offices, and we're also working in within a coalition of other child and adolescent groups that are focused on mental health to come up with some more substantive recommendations on how to improve the bill. And on the House side, the Democrats on the House Energy and Commerce Committee are also drafting their own comprehensive mental health bill. So we're also working with a coalition of groups to make sure that the children and adolescent pieces of that bill are strong as well, and that there are also opportunities for school-based health centers to provide some of these services. So I'm not really sure what the timing looks like with that, but I think in the next few months, and certainly in the new year, we'll see more developments on that. And then lastly, I'm sure as you are all aware and have been hearing about, there's sort of been a looming government shutdown threat for the past month. So by Wednesday, September 30th, they need to pass a spending bill, or the government will shut down. From what I'm hearing, it looks like most likely this will be averted, at least for now. It looks like tomorrow the Senate is going to vote on a short-term continuing resolution that will continue to fund the government through probably December 11th. And then the House plans to vote on it, and it should be signed. So it looks like it's more likely than not that we will avert a shutdown for now, but then in a couple months, when the short-term CR expires, probably December 11th, this will come up again. So just want to give everybody a heads up. And I don't know, we haven't, you all probably in the field know better than we do, whether you've been hearing anything from your sponsoring organizations on the possible impact of what a government shutdown, whether it's now, which is probably not going to be, or whether in a few months from now, what that might mean. I'd be interested to know if you all have heard anything. Has anyone heard anything from their sponsoring organizations about what a possible shutdown might mean or could mean in the future? Okay, well that's good, because we do know that in 2013, when the government shut down for about 13 days, I believe it was, we know that a lot of children's services suffer, such as SNAP and Head Start and things like that. So just wanted to keep that on everyone's radar. So that's my update. Are there any questions on any of the items?
Suzanne, it's Jessie, and it's not a question, it's more of a comment, but I was reading last week that the Department of Agriculture had advised our State Department of Social Services, our Medicaid agency, not to distribute the food stamp vouchers, or well, actually they put the money right on a card, like on a credit card kind of thing for folks, and they had advised them not to do it because they didn't know if there was going to be any money to be able to, for the state to be able to be, reimbursed through the federal government. But then on Friday, I read something that the Department of Social Services in Connecticut, at least, decided to go ahead and not delay putting the money on the card, on people's cards, and that I think that they're, on good faith, they're assuming that they're going to be getting paid from the Department of Agriculture. So I thought that was because it's really, that delay means a lot for families and so on. It means there's no money, and they're at the end of the month and they're out of money, and so it looks positive at the moment.
Yeah. I think that's a good sign, and I think, I agree with you. I think it's looking positive for right now. I just think if in a few months from now, we might be living this all over again. So good to be thinking ahead. Anyone else?
No, but I can say that Pennsylvania is in a little bit of a shutdown ourselves with no state budget. A lot of nonprofits and are really, really struggling because there's, 3 months into no state budget. So it's pretty much a crisis.
Wow.
Yeah.
All right, so the next agenda item up here is really around school-based health centers and managed care. I think in last month's state leaders call, Serena Clayton had kind of suggested that perhaps we needed to create a work group around managed care and really taking a look at, well, what does that mean for our field? How do we better engage them? What is the best way to engage them? And so I got some emails after that call that there seemed to be some interest. So I wanted to raise the idea to the group in terms of, is this a good topic that we should be tackling together? Does it make sense to use some time during this monthly call to talk about it? Us internally here at the national office, we've been having discussions about perhaps we needed to create a working group of folks, including some payers, to have discussions like this. So I just wanted to kind of pose the question to everyone on the call today is, what about this is of interest? What are some of the issues that you all are running into in your own states? And is this a good platform to talk through some of that?
I would be interested in. No, go ahead, Nicole. Go ahead.
Yeah, no, I was going to say that's definitely come up here in Maryland, and the MCOs are very interested in aligning with school-based health centers. I think part of the challenge has been we have so many different types of sponsors, whether it's F2HCs, local health departments, universities. There's just a lot of diversity, and so trying to figure out how to bring all those different voices together to talk about the issue is definitely a challenge.
Nicole, it's John. Can I ask a follow-up question on that?
Sure.
Is it the depending on the sponsor type, the treatment of school-based health centers different by a managed care organization?
Yes, very much so. And even the feasibility of contracting and reimbursement looks very different because there are jurisdictions that have very high-functioning systems for billing and reimbursement. Other jurisdictions don't. The NCOs want to be able to coordinate with school-based health centers and school districts to be able to share data so that they can be more targeted in their outreach and follow up with children and in particular adolescents who aren't getting their well care visits. So it's sort of a combination of things in terms of what the infrastructure and capacity looks like within the school-based health center itself, and then also what the coordination looks like across the school district, our state health department, local jurisdictions. It's sort of a there's a lot of relationships, a lot of stakeholders in that, and then people always throw up HIPAA and FERPA. Like that sort of creates this no man's land when it comes to sharing data and things like that.
Thanks for the explanation.
Mm-hmm.
I'm assuming by your description that your sense is the FQHCs have more capacity for creating relationships with managed care for their school-based health centers than some of the other sponsors, or does it vary there?
Yes, in part because they system-wide they already have those mechanisms in place and are already sort of working with private insurers and MCOs to provide coordinated care. So they already have a sort of a breadth of experience, and then structurally they're able to even bill at higher rates than local health departments because of their designation as an FQHC. So their school-based health centers are an extension of their FQHC sort of system and infrastructure, and so it looks very different for local health departments. And in some jurisdictions, like Baltimore County, their school-based health centers are actually managed by the school system. So there's such variety and diversity in terms of how people are kind of managing the operations of school-based health centers that it requires, I think, one, bringing everyone together, but also then the answer is not going to be the same for every sponsor nor every jurisdiction. Mm-hmm. But everyone wants to have the conversation because of ACA, because of sustainability, because of, perfecting coordinated care for children and in particular adolescents who often get missed as they get older. So there's a lot of interest, and everybody it's like all the different audiences and stakeholders are having the conversation, but just not necessarily in the same place at the same time to address some of the barriers that get raised. Mm-hmm.
Yeah, I'm interested from Pennsylvania in the EOB conversation, as it relates to this, because it's we are billing half of two so far of the 4 Medicaid managed care organizations in Philadelphia, hopefully a third one soon, but only one of them doesn't send EOB, so it's like this lost revenue for our adolescent reproductive health services. And I know there's just a lot going on in other states, and states that have already already, I guess, aligned their consent laws with their administrative Medicaid policies. But we've got a new governor and soon to have a new mayor in Philadelphia, so it seems like it's a good time to have that conversation. So I'd be interested in how, and how others maybe were part of, other school-based health groups were part of that conversation and moving that forward in states as we try and do that here in Pennsylvania.
Yeah, Kelly and Kim. Oh, yeah, go ahead, Kim. I was about to call
Sorry,
you.
this is Kim from New Mexico. So we actually have a fairly, in terms of relationships with MCOs, we have a fairly good relationship with our MCOs here in the Alliance in New Mexico. But I definitely think that I can speak for us and say that I think it's an important, I don't know if it would be a subcommittee or a topic that we continue to focus on just based on the next two items on your agenda alone. I mean, all the other things, of course, but every state's so different. It would be nice to hear how people are dealing with those different barriers that, Maryland and Pennsylvania are dealing with, but also that place of service code and the EOB suppression. I think the MCOs are a big piece in that puzzle, and I don't think that we should, I think we have to include them, and we would support that and share what we've been able to do in New Mexico. This is Kelly, and I'm one of those folks who emailed you during the last call, and we have been working rather closely over the past 6 months with our MCOs in our state, and I would love to hear what the other states are doing, and we're trying to pilot some quality initiatives with them, and I would like to see if other folks have done that and try and learn some lessons from them.
Yeah, I'd be from Pennsylvania again. I'd be interested in hearing from people or states that have gotten the commercial carriers on board, because we do have, half of the Medicaid MCOs on board, and hopefully a third soon. But still, that doesn't include the CHIP providers or some of the plans. It doesn't include their CHIP plans and just commercial carriers who've just completely shut me down. So I'm just wondering if others have had success there and any lessons learned or recommendations.
Thanks. So it sounds like you all are interested in kind of just having this as an item where you can kind of talk and brainstorm how everyone else is kind of engaging their payers. And I don't know, John in Michigan, if you have anything to add around the work that you've done. I know there was a few initiatives around kind of the medical home with, I think it was Blue Cross Blue Shield or another payer in Michigan in working with school-based health centers. And I don't know if there are any other initiatives that are going on right now in your state that might be of interest to other people on the call.
No, currently I don't have anything to add at this point.
I would love to hear from you, Kelly, what you all are planning on doing pilot-wise around the quality initiative. If you wouldn't mind sharing a little bit more, maybe that'll spark other people's ideas.
Sure. We are, it's very much in the initial phases. We're talking about trying to improve our well child. Not only would we increase our rates of well child exams in our school-based health centers, but the quality of the exams. So right now we're just trying to increase our numbers as the managed care organizations have, been incentivized in our state to increase those numbers. They're looking to the school-based health centers to help them do that, and of course we're very interested in doing that as well. So we're working together to try and identify, which students are up for their well childs, and then trying to coordinate efforts to get in touch with the parents. Right now, one of the managed care organizations is running a contest for the centers. Any center that participates is in a drawing to receive $5,000. The school receives $2,500, and each exam that the school-based health center submits to its Unicare in our state, they get a $25 bonus per submitted exam. So after we see what we can do to increase our rates, we're going to start looking at quality to ensure that, everything is being completed in the exam, and then we're going to look at what kind of referral system we have in place to get the kids into care that need it.
So Kelly, are those school-based health centers that are participating in the pilot, do they have a contract with those managed care entities? And are they getting paid fee for service or a different type of rate?
These are all, I don't know, we have a critical access hospital that's participating, but the rest are FQHCs, and these are satellite sites of them.
Okay. So they all have contracts with these managed care plans already?
They do, yes.
And then how are they able to track which services happen at, are they interested in seeing which clinics deliver which well-child visits, or do they just want their well-child visits to go up?
I'm not sure what you're asking.
So if there's one FQHC system that has two school-based health centers, one in one high school, one in the other, do they want to be tracking high school is doing more well visits, or do they just care that as a whole the well-child visits are going up?
They are just looking to get their well-childs to go up.
Okay.
Because we have such abysmal rates of kids, particularly adolescents is what we're looking at. Although any school-based health center is participating in this contest. We have another one running with Athena, where they are just tracking certain locations in the state where Athena has more clients, and they are looking to see if letters and then follow-up phone calls, and then they're giving gift cards to parents who get their kids in for well-childs to see if that will increase the rates in those particular areas.
Great. And how are you able to identify the students who need a well-child visit? Because how are you able to do that? Because I know that there's been other localities nationally that have wanted to do a partnership like that with the health plan, and then they ran into legality issues around that. So how is that information shared?
Well, the centers are using their EHRs, and then whether the managed care organization is using their database, and they're trying to look collectively to see, identify which kids haven't been in for over a year. And that is one of the issues that has made us look down the road at quality initiatives, because we're seeing that we have numbers that are, or data that is not matching up. So they're not exactly sure where that is coming from and how to best remedy that.
And these are the students that have enrolled, that are enrolled in the school-based health center, right? These aren't students for that go to a specific school, right?
No, these are kids that are enrolled in the school-based health centers.
That's great.
We've done something similar in, I was just going to say, we do something similar in Philadelphia, where the one managed care organization, a Medicaid managed care organization, actually signed a HIPAA business associate agreement with the school or the charter management operator, and shares the student names, and they give them back to the school, to us, with the care gaps, those gaps in care, and then we do outreach to those kids, to those students, and identify. So that, according to the lawyers, that we've been fine with that. I haven't been concerned, but that's what we've been doing, and the managed care organization has been really, really happy. I don't think that they actually are, when they run the data, I don't think that they're actually attributing the closed gaps to us. I don't think that they're necessarily running that data to say, oh, the gaps were closed and it was by these school-based health centers, but just in general, because sometimes we don't, it's not that we necessarily do the physical, sometimes we are just successful or whatever, operative in encouraging the parents to take the child for the physical, and then and then either bring us a copy for the school's records, because we do the school nursing as well. But last year, they said that 64% of their care gaps were closed of the students in those schools. So they've attributed it to our work, whether we did the physical or we just did the outreach and encouraged them back to their primary care provider.
Terrific.
Great. So anything else? I mean, is there, as the state affiliates, we've always been talking about what kind of work can we do together. So is there anything around this work that you feel like we should be doing together to kind of elevate or talk more about this specific topic as it relates to school-based health centers and managed care? Are there any thoughts that come to mind, or do you guys just kind of like it as a standing agenda item for discussion? All right. Well, moving on to the place of service code. We talked about this a lot on the last call, so I just wanted to put it out to the group to see if any of you guys have started outreach with your Medicaid folks to discuss this issue, and if you've been able to find out any information, any interesting information. Now's the time to kind of share those updates.
So, Serena, this is Jessie, and we've had some informal conversations about it in Connecticut. But if I remember correctly, probably after our last policy call, you sent us like some talking points, didn't you?
Yes.
About what we would share with our Medicaid agencies about why we think they should support this. I think I'm right. I think you sent us out something, didn't you?
Yeah, I sent out some key questions that
yes.
that we asked all the state affiliates to kind of circulate and and use as a way to talk with your Medicaid folks. And those were sent out via the email. I think they're also on the dashboard as well.
Yes. Okay. Yeah, I'll go back to that and continue those conversations, because I mean, I don't have confirmation, but I think that we, for a variety of reasons that would benefit the school-based health centers in Connecticut, I think that there would be interest, coming from our state toward, because you need about 5 letters of potentially of commitment from states, as I recall.
Yeah, we would need 5 letters of commitment, and we also need, those questions that I generated for all of you guys to take to use to have discussions with your Medicaid folks. I need their response. We need their responses from you. So depending on how those conversations go, if you could record that either in bullet points, something that can be shared with us, because that's the kind of information we need to write the letter, to write the request to CMS. Because we need some answers to some of the technical stuff that only your Medicaid folks will be able to really answer.
Okay. Go back to that. Thank you.
This is Kim. Yeah. Oh, hi. It's happened twice now. That's weird.
You're reading my mind.
Yeah. So in New Mexico, we do definitely have support for it, and so basically, I don't have much of an update though in regards to. We know that the Medicaid director is supportive of it. We also know that our senator is supportive of it, but things are moving a little slower at the Human Services Department right now. And so that's not on their top list of priorities. But we did attend, and I can't remember if we shared this on the last call, but we attended the Primary Care Association's billing meeting. And basically it's all the FQHCs that were there, and they were talking about how there needs to be something that they just need to be told what it is that they need to put down to designate it as a school-based health center. Because a lot of folks were saying that within their electronic medical record systems, they weren't able to do it unless there's a mandate from somewhere that they need to have, you know, a specific area where they would add in a code. So there is a lot of interest in the states. You know, people are supporting it, but things are moving a little more slowly than we would like. So I don't really have much substance in terms of an update, except for that they're supportive of it.
This is John in Michigan. I had a question about it. With the 3 questions that you had put out there, one of them was, why is a modifier not enough? And I'm having a little trouble with that because my understanding of a modifier is that it's used to define the service rendered, not where the service was rendered. Can you explain that a little bit?
I'll try it the best I can, John. All I know, and this is where I think Deb Brinson can be of more help to you, is that there are states, I think even including Michigan to an extent, that they've come up with some workarounds to help identify through the, you know, in the claims data which services were rendered at a school-based health center versus its sponsoring agency. So there are states that have come up with kind of a modifier, or they've used modifiers as a way to track that. And so what CMS wants to know, well, you know, there's options to use modifiers to do this, so why is that not enough? I mean, that's what the question that the lady at CMS posed to me. So I'm curious to hear from Michigan, from I think even Maryland to an extent, and Oregon, that have come up with these kind of modifier workarounds to help identify in the claims data which services were rendered at a school-based health center. I need to hear from those folks why what they've done isn't enough, and why a specific place of service code would help solve a lot of your headaches.
All right, thank you.
And so really my ask from all of you all on the call is, in order to write this, and it's great to hear that there seems to be a lot of buy-in and support from your states to do this, but our ask to you all is we need help to write this letter, you know, and some of that comes from taking those questions and filling in answers that you get and sharing that with us. But until we get some of that information back from you all, from your states, we're not going to be able to move forward with this request, because it's a lot of technical information. We need to create a technically sound letter, and we need that information from you all, from your states. Any other questions or comments about this specific topic before we move on to the next one? Great. Well, the next thing on the agenda was EOB suppression. A lot of you uploaded documents and background, you know, and materials you had on EOB suppression onto our dashboard. So if you guys haven't had a chance to take a look at that, there is a folder there with some information if you're tackling some of these, this specific area in your own state. But is there anything else that anyone wanted to share or talk about as it relates to EOB suppression?
This is Kim. I have a quick question. We have the coalition here that's working on this issue for school-based health centers, but also just for a lot of other vulnerable populations who are vulnerable to confidentiality breaches. We had a conference call, must have been Thursday or Friday last week, with Abigail English, and she brought up that she's been working with Andrea Shore with you guys at SBHA to do some webinars regarding confidentiality. So I was wondering if you had any information about those in regards to this whole topic.
Yeah. So, you know, if you are not if you're signed up for our weekly updates, we usually share our webinar announcements there. So I would say keep a look out in terms of those announcements. If you're more curious to know when exactly those are happening so that you could sit in on them, I would recommend you can email Andrea Shore and just ask her. when she expects to launch that specific webinar. I don't think there's anything on the calendar in the next few weeks about it, but also on the state affiliate dashboard, when you log in on the right side, we have a list of upcoming webinars, and you can see there too if there's anything around confidential services.
Okay, so I guess my question wasn't necessarily about the webinars themselves, because Abigail kind of explained that, but I was just wondering if you guys are working with Andrea on this issue then too, since she's doing these confidentiality webinars and whatnot, because she was telling us that they're going out to 3 different states to do site visits. I think it's Colorado, California, and Oregon, to see how their implementation of the either legislative action that's happened or regulatory action that's happened is actually being implemented, and what kind of the barriers are to that and what's working well. So they're going out as a team to do these site visits, is what she shared with us. So then she said she'll share, what the positives and negatives are, because we're trying to figure out a strategy here in New Mexico. So she also talked to us about some other states, and Nancy wanted me to I don't know, I'm not sure who's on, Maryland. So we're going to reach out to Maryland, New York, California, Oregon, and Washington in regards to how their school-based health centers might be implementing the new policies or the new state regulations surrounding the EOB suppression.
That's great. So, and that's great to hear that she'll probably be sharing some of her work on one of our national webinars. That's awesome. Great. Is there any other policy-related news or items that you all want to talk about? We have about 10 more minutes, so if there's a question you want to pose to someone, now's the chance to take advantage of the peers that are on the call.
This is John in Michigan. I will throw out there that Abigail English is going to be speaking at our convention. Kevin, if you're on the phone, are we recording that so we could share with the other leaders if needed?
Yeah, that's the plan.
Great. And is her topic going to be around adolescent services and confidentiality?
That's exactly what it's about. That's pretty close to the title, I think.
Yeah, that would be great if you guys wouldn't mind sharing with everyone afterwards a recording of that. That'd be awesome.
Certainly.
Anything else? You guys are a quiet group today.
I don't have anything else. Nope, from Pennsylvania.
All right. Well, then it sounds like we can end a few minutes early. So thank you all again for joining us on today's call, and we'll talk to you next month.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.
Bye-bye, everybody.
Bye.